change, and there's a lot of questions about, okay, what do we do next on all this? When is this going to end? And so I think that additional toll has been really, really significant. And so the extent to which we're keeping people employed in the construction industry, not only are they getting paychecks, not only going to be able to feed their family, but I think it reduces the level of fear and anxiety that's out there, which is something that is, proven to be a formidable adversary. So I want to thank everyone for being here. Why don't we go and, Kevin, if you want to make some comments, but I'd just like to hear from everybody about, how you're handling it, and what do you see as ways forward in the future to continue the momentum.
So thank you, Governor, and thank you for having us here. I think one of the things that you mentioned earlier about accelerating the projects, the benefits that we're seeing by being able to get that work done well in advance, so that when the traffic numbers and traffic is coming back, which you're seeing that, all of you, I'm sure, even getting here, you're seeing some of the traffic back on I-4, for example, here. All of that is now, everyone's seeing the reaping of that benefit of getting that done earlier. I think the group you have here, it's really unfortunate, is you have a couple of owners and chief CEOs of different companies in the industry, as well as those that are working out in the field. And part of the discussion we're going to have today a little bit is what's that meant to them. And I know we're going to ask them a few questions along the way. And I think with AJ and Mike and Michael and others, they'll be able to share with you some of the benefits of keeping and using the governor's vision of keeping us moving forward, and how not only are we able to retain jobs, and as the governor knows, the thousands of jobs that we actually provide when we in our work program, but obviously now also giving us the opportunity to also add jobs because of those that we could redirect as those skilled tradesmen and so on. So, Governor, glad to be here, and I know AJ and the others will be able to share some information. So, AJ, maybe you want to share a little bit from your experiences.
I think the pandemic created some opportunities, and I think the department did a really good job being proactive and first of all, determining our business essential. We're essential for commerce, we're essential for the public, and keeping us working the best we could. We've had to implement a lot of safety measures, and our business has changed a little bit, but it's been a good partnership. I want to point out just two things. DOT has implemented a workforce development program to try to bring people into our industry. And COVID shut it down because we were having training sessions where we'd have 25 or 30 people for a week that we would bring in from underserved communities that weren't employed, and we bring them in, we would train them, and DOT immediately acted and changed that program and provided a new program probably in early April, and we've hired hundreds and hundreds of employees to do that. So I think that's point one. You mentioned the 395 I-95 project. On that project, in South Florida, in Miami, you've got like a 6-lane highway in each direction. When traffic was reduced, we were able, we're doing concrete pavement rehabilitation where you basically remove and pour concrete every night. And the fact that there was less traffic on the roads, we did traffic analysis and we're able to shut down actually three lanes at a time and work round the clock and greatly improve productivity. So the schedule for the I-95 piece is probably moved up maybe even 6 months. And the overall job has not moved up 6 months, but it was a tremendous benefit for traffic. And let's get the work done now when there are people on the roads. And we're seeing a dramatic uptick now in traffic, and we're not back to where we were, but I think taking advantage in April and May of those reduced traffic was really good. It was a smart decision by the state.
Great.
I want to thank you, Governor, for supporting our industry and allowing us to be represented on your task team to open Florida up, which I think was, thank you very much. Really, really appreciate it.
Sure.
Mike?
Hi, Mike Coran, Ajax. I think the biggest thing is declaring us essential was so important because for us and our company, that probably saved 400 jobs right there. Although it was a little trepidatious, I guess you could say, and it was on again, off again, but we found a way to get through this, and we've kept our people working, and they're very thankful to have their jobs. I can guarantee you that. And our safety department has done a great job because right now we have under 4% positives in our company, which I think is a pretty good number. But again,
how do you determine like your testing? What's your
our HR department keeps track of it. They keep a log of who goes to get tested. Then we get the results back.
Are you requiring to, or they just do it if
they have symptoms?
Yeah.
We require them to. Yes, absolutely. But they've kept the 6-foot distance, and our crews, of course, they're far apart. We're not in a building, a confined space. We're outside. Big benefit for our kind of business, and that's been a positive. And our people have stepped up. They've finding a way. It's been hard for families because kids are home and everything. So, but it's going well. And right now we continue to get better, and we feel pretty confident. We thank you for that essential, though. That was super important. And the other thing is about our business is mines kept open because we buy rock. Sand pits kept open because we buy sand. Truckers that deliver materials to our asphalt plants are busy. We keep just not our business busy, but other ancillary businesses that we depend on. And our subcontractors, again, they kept busy because yeah. So we had a pretty good backlog going in, and it's been super good for us.
Yeah. No, and this whole this is the first time that this country has done this for over 100 years because the 57 and 68 pandemics, you didn't see this type of mitigation. But I think this whole idea of essential, non-essential really needs to be rethought because the fact of the matter is pretty much anyone's job is essential to them. And so, that was the framework we had, and obviously I interpreted that broadly because I wanted as many people to go to work as possible. But it is inadequate. I don't think it's something that we should continue in terms of that framework in the future. And I also think that particularly with the coronavirus, COVID-19, that has a disproportionate effect on elderly and folks with serious comorbidities, it's not even a good proxy for shielding the people that need to be shielded. I mean, what happens is the impacts on someone in a white collar industry who can work from home is minimal. But then when you're talking, if any industry that's, quote, non-essential, that has more blue-collar folks who have to show up, they then bear the brunt of it, even though they may be in the lower risk groups. And so it's something that really does need to be rethought going forward. I think it's clear, from where we're sitting now that was not the way to go. And I would say, our indicators now, we've seen a 3-week decline in COVID-like illness ED visits. Our hospital census is 20% lower for COVID, than it was in the middle of July. We continue to see declining, cases and positivity, and I think you're going to continue to, to see those trends. But that was able, that happened. That viral cycle happened without, shutting down the state. I mean, we've had Disney open, we've had these other things, and so I think it's keep society as healthy as you can. You want people gainfully employed. To send someone out of work, that's just going to add to the anxiety and the stress and the fear that's out there. And so this industry showed, you can do it through there and do it safely. And I think most of the places have done a really good job. I mean, I remember when everyone was so concerned about like a hair salon. But you go in there, it's like an operating room. I mean, they're really keeping it clean. Now they're back in business. And don't forget, people were getting their hair cut when that wasn't, quote, essential. So don't kid yourself on that. But I think doing that, so that the essential, non-essential, not the best way to view it going forward. I tried to do it as broad as possible, but at the end of the day, we just have to recognize there's some serious limitations for the effectiveness of that approach. Okay, go ahead.
How you doing? Michael Vasilio with the Vasilio Group, parent company of Ranger Construction. And others. Just wanted to, once again, Governor, say thank you so much for keeping us working, not just as a head of a business, but also as somebody that's part of a family business. Because I know that, it's not just my workers that we've been concerned about and focused on with safety, as has been talked about by the other folks here. But I know that we've had employees just say thank you for being able to keep everything going, not just for themselves, but for their families. And I think that that's been key for us as well, that, as was talked about before, it's not just our employees, but it's all the other businesses that go around, and the multiplying effect is unbelievable. And I know that those families have been appreciative that everything's been able to stay the way that it's been, and keep people working and keep things moving. We have been very nimble, I think, as everyone has, with the CDC changing guidelines, and as everyone's learned more, and I think our approach has been pretty good so far, and we've tried to stay on top of it and taking your leadership, Governor, about what needs to be done and to keep our folks safe. And as has been said before, we're working outside, and we're able to keep most of our folks distant already, even before we ask them to do different things with the hand washing and facial coverings and other things. So keeping that distance, I think, was probably the strongest thing that we saw for our folks and working outside. And it's been a real benefit. So thank you, Governor.
Yeah, and so with the CDC doing some revised guidance in the last few weeks about employees returning to the workplace, I think that they did a really good job of just kind of surveying the facts and how this has actually worked in relation to testing versus symptoms. And basically what the CDC said is, if you're somebody that tests positive and you go 10 days without symptoms, then you're cleared to come back because you're not going to be infectious at that point. And that's just based on the experience of dealing with the illness. What was happening is, and we actually had it in some of our requirements, like in restaurants, to get a negative test. The problem with demanding a negative test is these PCR tests will pick up just particles, RNA particles. So it could be dead virus. And CDC has seen people test positive for up to 12 weeks. Obviously, you only carry live virus for a very short period of time. People think, basically up to about 7 days. And so it was creating, I think, unnecessary roadblocks. So obviously, you don't want a situation where you're not screening people to come back to the workforce, because if they come back and they're infectious, then obviously they can infect other people. We want to avoid that. But you also don't want a situation in which healthy people are being told they can't come back to work, or told that they have to isolate for 14 days or however long. And I think we're seeing more and more with these tests, you have false positives, you have these different things. And so I think the symptoms-based approach makes much more sense. That's incidentally what most of the hospitals have gone to. So if you have a nurse, somebody tests positive, if they're symptom-free for 10 days, they're back in the hospital without needing to get a negative PCR test. And I think that that's the way to go for us going forward. It also, though, kind of that analysis that the CDC did specific to the workplace, I think raises broader questions about, what is the utility of a PCR test if you truly are symptom-free? In other words, if you test positive, can we tell you that you have an active infection? And I think in most cases, I don't think when you're asymptomatic, we don't know either way. I mean, maybe if you had one clear exposure, then you're tested, and then it comes back positive, you may be able to say that. But even if you can, if the tests aren't being turned around in time, then you're not even going to be infectious by the time that's over. So isolating people who aren't sick or who aren't infectious, that's a harm we want to avoid just as much as saying that somebody who could be infectious will be put back into the workforce. And I think the symptoms-based approach is a superior approach. We've obviously tried a lot with the test-based approach. We've had people that have tested positive 6 or 7 times after the 14-day window. And it's like, okay, this is dead virus that they're picking up. It's not infectious anymore. But when that's the rule, obviously businesses aren't going to want, that used to be the rule for the hospitals, they would obviously insist on it as well. So that, I think, makes more sense. And I think it's, it really probably threads the needle nicely. So we want to hear from some of our...
Governor, I can say I'm right there with you, because we've seen the same thing in our business, where we've had folks that multiple weeks, multiple tests, and it still comes back positive. And so we're certainly looking at what the CDC is saying right now. We're looking at, where do we draw the line ourselves? And, if we're going to go 100% that symptoms-based approach, I think that will certainly allow us to get several of our folks back to work quicker, because we've seen the same thing that you've seen in much smaller population, of course, but it's directly affected us and our folks for sure. So thank you.
Absolutely.
Hey, Chris, I know you're a superintendent here on the local projects. Tell us a little bit how, the being able to work and continue to work has kind of helped you. I know you do a little bit of commute to get to your work site, so kind of share your experience.
It's actually, I don't know if it's been better for me or better for my wife and daughter, me not being stuck at home with them, because I probably would drive them crazy. But I do want to thank you for letting us work and letting my guys work and be able to provide for our family. And our company, Hubbard Construction, has done a good job. They got out in front of it in early days and got the sprays out and the everything out to the field. We wipe down equipment every day, daily. The people try to stay in the same equipment. We have not really seen a lot of coronavirus on our job sites because we are running equipment, we're staying outside, and we're away from each other. But it's been a blessing to continue working.
Yeah, I think the outdoor work in particular, again, it doesn't mean that it could never happen where you have transmission, but I think clearly this thing prefers enclosed environments. It prefers the air conditioning, nice temper. When you get outside and it's more open space, more difficult, and then the heat and humidity aren't good for it either. Part of the things, like when you see the cases and stuff go up in the Sun Belt when the summer started, a lot of people thought that because it's hot, that wouldn't happen, that it would probably be in the fall. But I think more people are more inside when it's really hot outside, and so you actually have more opportunities for that. What is you hear about, there is fear out there about this. I don't think that. I think people. I think the risk for people who are working age is very low, but nevertheless there is fear. Were your guys? Did they really want to get back? Were some worried about it, or what was the mindset maybe early on, and then what's the mindset today?
I would say early on people were worried because they didn't know.
Yeah.
After they started finding out more about it, the older fellas, because Hubbard Construction has a lot of people that have been there 30, 40 years. Maybe we were worried about those type employees, but they all wanted to get back to work. Every employee at Hubbard is somebody who wants to be productive, who doesn't want to stay at home, who wants to get in here and build something. And so if they had to stay home, it would have been awful for those guys. And
were you guys, once the economy started to change and there was more people out of work, were you guys hiring new people to come in who hadn't been involved in the industry before?
Yeah, for what we needed, we did see some upticks, like Mr. Tebow was saying, carpenters coming off of high-rise buildings would be coming. You need bridge workers. So it did benefit us in a couple places.
And where you commute from where?
From Hillsborough, Lithia.
To Orlando?
Yes, sir.
Okay. Yeah. So how's the traffic been?
At first, it was good. I enjoyed it. It was a double-edged sword. You enjoy not having the traffic. And traffic past month is steadily increasing. It's almost back to where it was.
Yeah, it's exactly a double-edged sword, because it is good to get around. At the same time, when people are out and doing things, it's a sign that people want to come back. But I-4 from Tampa to Orlando is somebody who, when I was campaigning, I'd drive around the state. You could be like a Sunday afternoon and just get the lockstep in like Polk County or something. So it's definitely one of the stretches that you're concerned about. But we appreciate what you guys are doing, because the folks that are on the job are really helping the state move forward. And I know that having those jobs there has been important. for you and your families, but also, if those weren't there, that creates a lot of problems, into the future with stress, anxiety, depression, all this stuff. We're seeing that in other sectors, and so I'm really, really glad that you all are working hard. Who else? So we have Will.
Yeah, Will is his background's in engineering and construction management, and Will, kind of share what your perspective is.
Yes, Governor DeSantis, working in the construction industry during the COVID-19 outbreak has been something to become more accompanied with or adjusted to. And I would say that local contractors here in the state of Florida and Central Florida have been stepping up to the task of trying to figure out how to bring people back on a work site, keeping them safe, and continue to build the projects, taking advantage of the slowdown in traffic and exposure to the traveling public. I know that the guys that I work with on the day-to-day, my job is to make sure that the job is being built, the personnel that we have on site have what they need to be safe and do it correctly. COVID has just added a different dynamic to that, but just making sure that my guys are safe, making sure that they can go home and continue to bring money home to their family, but also do it safely, has been very important. And companies like Superior that I work for have been stepping up to the plate and coming up with plans to keep the projects moving. So we appreciate being able to continue to work.
Yeah, I mean, it's like obviously with COVID, there's safety concerns, and sometimes people forget. You guys live and breathe safety every day because you have risks in your job, and you gotta do whether it's protective equipment, whether it's some of the other things, and so we appreciate that because I understand it's not always the easiest work, but it's really important, and if we didn't have that going on, it'd be much more difficult for our state. How have your folks? Is it similar to what we just heard, just in terms of people really, glad they have the job, or are there people that are still concerned, or was that more just at the start? How would you describe the mindset?
In the beginning, you had a lot of people that were apprehensive to how they were going to be protected and how they were going to continue to work. But everyone that has returned or continued to work is very adamant about continuing to work and being able to provide for their family. But at the same time, just making sure that they're safe. Yeah. Making sure that we as the people in charge and as construction professionals are providing whatever needs they need to be safe and continue doing that work. So.
And are you based in Central Florida?
Based in Central Florida, yes, sir. Okay. And been working here for 4 years now.
Oh, okay, yeah. Good. So. Well, we appreciate what you guys are doing. It's been important for the state. You guys have anything else? Is there any other thoughts or concerns about we on a budget? It was a very tough budget year for us. The legislature puts it on the desk the second week of March, which we knew obviously we were dealing with coronavirus, but it went from kind of one level to a whole new level in terms of the economic shutdown very quickly. And so that obviously changed the revenue outlook. But even though I did more vetoes than's ever been done, $1 billion, we were able to fully fund the work program for FDOT. Because I knew that it was important. There were some smaller projects outside of that didn't quite make it this year, but maybe we'll look going forward. But we do think it's really, really important to continue Florida's focus on infrastructure, and we obviously understand what it means for people's families to be able to have the ability to do it. So we're all in for it. We want to keep it going, and I think that'll continue. I think when people start, when we get further out from this and they look back. And I think we're going to recover better than some other areas, but some other parts of the country. But I think they're going to look and see that this was really one of the rocks that kind of kept Florida afloat when we had the tourism crash and some of the other stuff that we so much depend on. So appreciate that. The other thing I'll just mention is we have launched this committee to look at ways to bring visitation into our long-term care facilities. It's headed by a great lady out of Northeast Florida, Mary Daniel, but we also have our ACA secretary, our Department of Health Surgeon General. We have the head of the Alzheimer's Association, some great people. But basically, if you look from the middle of March, we've not allowed visitors into these facilities because They are the most vulnerable for COVID spread and, of course, for really negative impacts from the virus with a very vulnerable population. And so that has been in place since the middle of March. Now, obviously, we've done a lot. I mean, you know, they have to wear the workers wear the PPE. They get tested regularly. We've tested the residents once already. We have COVID-only nursing facilities to help with isolation. So there's a whole bunch of stuff we've done to really limit the damage. And I think it has been effective. And I think we'd be much worse off had we not done it. At the same time, we recognize the toll that not having visitation takes on families, and obviously the residents themselves are lonely, but also the families who, a lot of these folks were big parts of the caregiving that happens in these facilities. And so, you know, Mary was somebody who this policy went in effect. Her husband was in a memory care center. She obviously couldn't visit, and you know, she wasn't sure when the visitation was going to be allowed. And quite frankly, you know, it was an evolving situation. You know, we didn't know. We wanted to allow it, but we needed to see what would happen. And so she got a job at the facility washing dishes. She's able to then see her husband, which is it's a big deal for her. And so we look at that and think about the number of people who, and not just limited to coronavirus. I mean, there's folks in long-term care facilities who pass away from natural causes or from other illnesses, and they haven't had the ability, you know, to be there with their families for many, many months. And, you know, we've put in iPads and do FaceTime, and sometimes they'll do these window visits. And honestly, that's better than nothing, but that is not the same as that personal contact. And so they're going to be working on a way forward, a safe way forward, but we're very mindful of taking actions which do, you know, protect and save lives, but we're also cognizant of how that affects people's lives. It affects the individuals there, and it affects the families. I don't think any of the families want there to be no precautions. I think a lot of these are good, but I do think they just want to have how can they safely go in and be able to spend time with their loved ones, particularly their loved ones, you know, who are nearing their final days, because you're not going to get that chance again. And you know, one of the things that bothers me is just the number of people who weren't able to say a proper goodbye. So we want to address that, and we're working hard on it. And with that, take some questions. Well, I'm not sure exactly what you mean. I mean, I think, you know, the health departments are informing decisions, but it's ultimately not their decision. It's the responsible party's decision, you know, whether it's at the local level with the superintendent, school board, the commissioner of education, the people that are there. So you use that input to be able to determine, you know, the policy. But you can't just delegate that out, I think, to somebody who's not accountable to the people. Because it's not their decision. So they can get advice, they can get input, but it's not all up to the health department to say a yes or a no. They inform the policymakers, they provide information, and they should absolutely do that. But to say that they should be the ones that would have effectively veto power, that's just not the way it works. And so it's an advisory role. They should absolutely be working. They should be providing input. They should be doing that. But what I don't want a situation is, you know, you have a school district that has a plan to go back. They're offering parents virtual. They're offering parents in person. They got the teachers, you know, most of the teachers want to be there. And then you have one person to say, don't do it. This has got to be more collaborative. So they should be involved in providing information, but I don't think that you should have the veto power. Yeah, so two things. One, the bid's being protested. Two, as governor, if you look at the law, I'm not allowed to be involved in that in any way. And there's good reason for that. So I have not been involved. I don't like it. Obviously, we're investigating the unemployment and how, you know, it's one thing to have a faulty system, but $77 million that was paid So we need to look at that. So it would be my preference that they not get anything. At the same time, there's a process, unfortunately, that has to play out. There is a protest in place, and I know that the DEO submitted a negative recommendation as part of the process. So that information was before, but I think what happened is they just dropped the price by so much that under the current law or however they make those decisions, they their hands were tied. I can't go in and just void it legally, but I think most Floridians want answers on the unemployment, and that really should happen before any of this other stuff does. Yes, sir. So here's the thing. I mean, I think we are in a situation where, we've got to get through this viral cycle. I think the indicators, if you look COVID-like illness, if you look at positivity, which I think we've seen is not always the best indicator because of the way the tests are reported. The hospitalizations, a great movement downward everywhere in the state. And so let's just keep that going. And then as we get over, see. I think the problem, well, I'd say two things. One, in the defense of the bars, people will try to blame the bars in like Orlando. And look, I'm not saying it didn't contribute. Miami has not had bars open since March, and they had way more cases than they've had in Central Florida. And so let's just be clear about that. The places that had the biggest outbreaks did not have bars open at any time since the pandemic started. And my sense is people will get together. They'll just do it in private residences, and I think that's what was happening in South Florida. So I don't think they should be the boogeyman or be blamed. At the same time, we had a very measured rollout on this for the Phase 2 counties. And it was not having them operate like they're used to. Unfortunately, it was, if a restaurant can do 50% and serve you food, if you seated, same deal, why can't you just go in and drink wine or do that? And that was the vision, and that just wasn't something that was followed. And so the secretary he started to play whack-a-mole, but then the reports were coming in from all over the state, so he said, you know what, we're just going to have to suspend for now. So of course I'm willing to look at it, but I would just tell people, we need to get through this period first. And as I said, I said 2 weeks ago, that I thought the indicators were starting to turn positive. I was like, oh my gosh, what are you talking about? Because some of the ones that are leading indicators, now you're starting to see the other indicators follow. And I think you're going to continue to see that because I think people have done a good job. And I think that that's the way these things go. So we'll look at it. And obviously I want people to be creative. And in Florida, other than nightclubs and pubs, everything is allowed to operate here. We've been operating. I think we've shown that, you can operate, because there are people saying Florida needs to shut down the state, otherwise we wouldn't see any improvement. Well, we have seen improvement, and I think part of the reason is because we kept people employed as much as we could. We kept society functioning. I think that probably reduced the level of stress that we otherwise would have had. And I quoted D.A. Henderson, the great epidemiologist from Johns Hopkins, who's leading figure in eradication of smallpox. I mean, he said before he died, he wrote a paper, one of the overriding principles is, the more society can function normally and reduce anxiety, the better you are at handling epidemics. I think that's what we've tried to do here. At the same time, that's just one we're going to have to figure out, how to deal with. Yes, sir. Well, obviously, I think that if you look at how Florida's been impacted, I mean, that's the number one impact. There's no doubt about it. Part of it was I think a lot of people were very scared. March, April, obviously a lot of this stuff closed down. As we've kind of opened, Universal, Disney, I think they've done a really good job of putting safety first. I think most people look, and I think that they understand it's a safe environment. I think one of the things that's been difficult is normally we'd have all kind of conventions like this. I appreciate the road builders for still doing this because you can do it safely if you just make proper precautions. But I think that has been one of the major problems. I mean, just think, heck, I think I was scheduled to speak at 3 or 4 things in June and July, 6 months ago, that none of those things ended up happening. And so, we want those to come back. But I would just tell groups and stuff, these hotels have done a really good job on doing the different safety precautions, and they're putting safety first. It can be done safely. I think you will see an improvement on that. I mean, obviously, when you're in a situation where, the headlines nonstop are cases, usually, in my humble opinion, not without all the context and perspective that I think it would make people feel a little bit better. So you're going to see people, get this impression. I mean, I can't tell you how many hospital executives have told me, my friend in Boston was like, my God, you guys have no beds left. And he's like, no, what are you talking about? He's like, well, the ABC just said, World News Tonight, Florida was out of ICU. He's like, I've got, 25% of my, so, there was also, I think some of that perception, just as we get through this and people understand that it's been, that we're going in a good direction, will help. But I also think we've had a lot of stuff going on throughout the state that, folks don't necessarily always pay attention to. I mean, I know like Northwest Florida, has really done well. I know there's been other parts. And then some have been really, really struggling. I mean, I think Orlando's done a good job of limiting, mitigating some of the damage, but they're not where they need to be, obviously. We know that. South Florida, I think, is probably further behind, so we'll see how they go. But, yeah, I want all these people back to work. I mean, these are folks, it's just as a guy who's attended events now for years and years, the folks that work in this industry are great people. Everyone from someone that's working at the bar, serving, working in the kitchen, working in the hotel. These are good jobs. These are good important parts of our community, and I want them to be able to get back. I do think, though, that as we continue to see, which I think will continue to be positive trends, we will have an opportunity to see some improvements. But I would just tell people, if you're thinking about having an event, there's no set of hotels or convention centers that understand the safety better than what they do, not just in Florida, but specifically here in Central Florida. They understand how you can put on an event, with the appropriate protections, so that you're creating a low-risk environment while still being able to do things, that make an impact. And that obviously will be big for our community. If you look at the unemployment, and we'll get last month's figures, coming up here shortly. But if you look at the last figures that we had, the area that got hit disproportionately, was Osceola and Orange, precisely because of that. And I think it was 16% unemployment. I think it got up to in Osceola, and Orange was close by. Those numbers could turn around, as we get this going. But they've come to me on certain things. I think that our symptoms-based approach to the employees will be helpful for all employers, but particularly for hospitality, because if somebody is over the illness, they can come back. And they don't have to just get a test for 10 days, even though they don't have, even if they're not sick. So I think that that'll be helpful for them. And then we've, wanted to empower them to make decisions about doing different things with the proper precautions. And I know I've talked to a lot of the folks running these hotels, and they do more than I would even think about doing. And so sometimes people always look for government to mandate, but I tell you, they understand it's in their interest to create an environment that people want to be in. And I remember talking with Harris Rosen about some of the stuff that he was planning on doing. So it's pretty impressive. But all in all, we all know this is an important engine for our state here in Central Florida, and this is an important industry, not just for obviously tax revenue and all that, but for the livelihoods and the jobs that come with it. So we're going to continue to be supportive of it, and we want to see everyone back to work as soon as possible. Thanks.
Thank you, Governor. Thank you.
Keep up the great work. Thank you.
Yeah, take your souvenir. Can't reuse it there, Will.
They can't? Yeah. Maybe we'll just leave it here for next year.
Here, hold it up. Hold it up. I'll take a picture of you.
Yes, sir. Thank you.
Your cell phone number on your card there that you give me?
Yes, sir. Yes, sir.
Okay,
Send it to that
I'll text it to you here in a little bit.
Thank you so much, Mike. It was really nice to meet you.
Yeah, nice to meet you too. Good luck with everything.